But Allison, meanwhile, you're back in Mississippi after visiting the state when cases were reaching record highs, but there are some good news to report today.
Yeah, I mean, when you look at the COVID death rate per capita, Mississippi is still among the highest states. But when you look at their number of new infections and their hospitalizations, they have really improved in recent days. They have decreased across the board. And we came back here to this hospital, this ICU, because we were here a month ago. And when we walked into this ICU just last month, the first thing we immediately saw were doctors, nurses scurrying around because two people who were in ICU because of COVID-19 needed to have chest tubes placed in their lungs. One of them, a pregnant woman. This time when we walked on the ICU floor, one of the first things we noticed was that it was not nearly as crowded. They even had an empty room. Doctors, nurses, respiratory therapists here, they tell us that things are more manageable now. Before they felt like they were drowning. Now they say they feel like things are somewhat under control. And they also say they're hearing a different tone from people when it comes to COVID-19 vaccines. Here's more.
At its worst, I would be hearing things like I would never get vaccinated, I'd rather die than get vaccinated. I'm not hearing such strong reactions anymore. People are becoming more pliable, more willing to say, yeah, maybe I should get vaccinated. Even people who are admitted to the hospital with COVID are now beginning to say, yeah, I'll probably get vaccinated after I get over this. And I wasn't hearing that before.
When we last talked to Dr. Babar, he had this conversation, this story with us that I think stuck with a lot of people, where he talked about having a conversation with a non-COVID patient, telling her that she had high risk factors and she should consider getting vaccinated. And she told him, I would rather die than take a COVID-19 vaccine. He says that that has started to change here. And in large part, that's because a lot of people know someone who has gotten really sick with the Delta variant, and many people that needed some sort of higher level of medical care. Now, Dr. Babar also told us that rising vaccination rates in this state, it is contributing to the drops and the improvements they're seeing here, as well as levels of natural immunity. But one thing he wanted to make very clear, and he emphasized, is that they still want people who have had COVID-19 to get vaccinated, because there have been a number of studies that have shown the antibodies you get, the natural antibodies from having COVID-19, they don't last necessarily as long as the antibodies that you get from a COVID-19 vaccine. There was a study just this month published by the CDC that looked at that, and they said that not everyone who had COVID-19 even developed antibodies. 36% of the people who had COVID-19 in that CDC study, they didn't develop any antibodies after having it. But when they looked at people who had at least one dose of an mRNA vaccine, every single one of those people developed some level of antibodies. Jose?